According to health experts, improper hand washing and washing hands with dirty water exposes one to gastrointestinal infections that include respiratory infections like influenza and coronavirus. In her speech read by the State Minister for Water and Environment, Issa Sekindi, the Prime Minister of Uganda, Robina Nabanja, noted that many Ugandans have taken hand washing as a simple issue that they think does not matter to their health.
Hand washing may seem like a simple matter, but it is far from that. It is a cornerstone of public health, a fundamental action that can save lives and prevent the spread of diseases. And epidemic like COVID-19 and recently Ebola in Mubende.
She said compliance to hand washing helps to reduce the burden in the health sector of this country.
Fewer infections means fewer hospitalization. Let us commit ourselves to fostering a culture of hand washing in our homes, schools, workplaces, and communities.
Sanitation coordinator at the Ministry of Water and Environment, Martha Naigaga, explains that water coverage in rural and urban areas of Uganda stands at 68% and 73% respectively.
The access in urban areas is slightly better than the one in rural areas, and mainly because urban areas we have gone ahead to construct pipe systems. In rural areas we've been using mainly point water sources like boreholes, like springs, but there has been a shift at the Ministry of Water and Environment towards doing more piped systems. We have also been targeting achieving at least one safe water source per village.
According to the Ministry of Health, most intestinal diseases among people are because of poor hand washing.
Then we have the common ones, the diarrhea, dysentery, and then cholera, which we had recently in the country, and so forth and so forth. So you're likely to be exposed to a number of those gastrointestinal complications. There are so many other conditions that are not directly related to sanitation, but are actually as a result of poor sanitation and poor hand washing. Now you as a media person, you have a role to sensitize and advocate for hand washing. The leaders have a role to play. One, to provide to invest in wash through funding, but also to sensitize and create awareness among our people, but also to provide infrastructure for wash.
Arua District Water Officer Patrick Odongo said many members of the community do not clean water containers to fetch water, adding to the contamination by surface runoffs as natural water sources are exposed to open defecation.
You find that you are going to fetch water from a clean source, but the container you are using is dirty. So you find you break the chain of cleanliness. The issue of contamination of water sources is basically what we call surface runoff. It happens basically on the springs, because you find water flows after it rains, it flows to downstream, and then it infiltrates into the ground and comes out in the springs for people to take. That's where you find this contamination. We are getting diarrhea, we are getting typhoid each and every time. It's because of open defecation.
However, high water tariffs also contribute negatively to hand washing behavior, a challenge that adds to poor access to clean water sources by many Ugandan communities. To that effect, the Parliament of Uganda has been called upon to revisit the current water tariffs for adjustment so that water becomes affordable to everyone.
We are paying 4,100 domestic tariff, which is very high for a local person who is a farmer. This is where we want to appeal to the MPs, the Parliamentary Forum on Water and Sanitation, to work on the tariffs.
It is usually by an act of parliament that price is determined at that level. So we promote other forms of water that are available to us, like rainwater harvesting.
Arua District Woman Member of Parliament, Lilian Paparo, calls for more sensitization of the public about hand washing. Joseph Odama, UBC News.